Health has confirmed that 15 out of 18 COVID-19 cases that were subjected to sequence analysis at the Kenya Medical Research Institute turned positive for the new Indian variant. While marking Nurses International Day on Wednesday, where the ministry received donations of personal protective equipment, health officials warning that individuals need to be extra vigilant to tame the new strain. This comes as the country recorded 410 new infections as the government gave an assurance that the second dose of the Oxford AstraZeneca vaccine is expected to start being administered from the first week of June.
Kenyans may be forced to be extra cautious as they go about their daily duties as the Ministry of Health confirms more cases of the Indian variant in the country. These are some of the individuals who had just arrived in the country from India before the country stopped flights from India. They were subjected to antigen tests, then PCR, with sequence analysis at Kemre confirming the most dreaded Indian variant.
And I have just received results that 15 out of 17 cases of those samples that were tested turned out to be the variant of concern that is now widely spread in India. One of the sequences was the variant of concern, also known as the UK strain.
Fortunately, there have not been any community transmissions of the Indian variant at the KBC site in Kisumu following the recent arrival of contractors from India.
We are working very closely with the team in Kisumu. Last week on Friday we had a meeting that was chaired by the governor of Kisumu County, and we have agreed on a raft of measures, including the testing of the 70 people who had been identified through contact tracing.
But with the presence of the new strains in the country, health officials say Kenyans cannot lower their guard yet, even as the ministry heightens surveillance in detecting the new variant.
What this tells us is that we need to be very vigilant. You can see that it's quite widespread now, the Indian variant, and I think we really need to be extremely vigilant.
The paramount importance is that the public health social measures will work for this variant and other variants that have been declared variants of concern. So I think the message to the public is that if you wear your mask properly, you hand wash, you keep physical and social distancing, and of course you receive your vaccine, then the risk of you getting the virus is drastically reduced.
This comes as the healthcare fraternity on Wednesday received donations of personal protective equipment from UK Liverpool School of Tropical Medicine and Lord Mahavir Swami followers in commemorating the International Nurses Day.
The British High Commission in Kenya is working hard to support the government's response to the pandemic here in Kenya. For example, we're providing cash to households that have been hit hardest economically.
We will continue with our endeavour to help our people in these times, and it has always been our project that we help people whenever there is a need.
Meanwhile, individuals who received the first jab of AstraZeneca vaccine are set to receive the second dose from 1st of June.
Even as we remain hopeful of the shipment of the second dose through the COVAX mechanism, we are also pursuing other avenues to ensure that this will happen and that the second dose will be received by Kenyans on that day.
On Wednesday, the country recorded 410 new positive cases from a sample size of 3,799 tested in the last 24 hours, with the positivity rate standing at 10.8%. 22 succumbed to the virus, bringing total fatalities to 2,950. Kamchemenza for Channel 1 News.